Every 40 seconds, someone suffers a stroke. It strikes fast, often without warning, and every second that passes can mean the difference between recovery and lifelong disability. But what if there were a simple, science-backed technique that could help protect your brain in those crucial first minutes before help arrives? A method so effective that doctors around the world are now urging seniors to learn it because it could save their lives or the life of someone they love. Stay with me, because by the end of this video, you'll know exactly what to do in those critical 3 minutes that could stop a stroke from becoming deadly. Strokes are one of the leading causes of death and long-term disability worldwide. They don't discriminate men and women, young and old, but they hit hardest among seniors. When a stroke strikes, it happens because the blood supply to the brain is suddenly interrupted, either by a blockage or bleeding. And when brain cells are deprived of oxygen, they begin to die fast. That's where this 3-minute trick comes in. It's simple, it's practical, and it can help preserve brain function until professional medical help arrives. In this video, we'll break down what causes a stroke, how to recognize it within seconds, and most importantly, what immediate action you can take that could save a life. One, understanding a stroke. What's really happening inside your body? Let's start with the basics. A stroke happens when blood flow to part of your brain is blocked or reduced. This can occur in two main ways. Ischemic stroke, caused by a clot blocking blood flow. This accounts for nearly 85% of all strokes. Hemorrhagic stroke, caused by a blood vessel bursting and leaking into the brain. In both cases, brain cells are cut off from oxygen and nutrients. Within minutes, they begin to die. That's why speed is everything. Every minute that passes during a stroke, nearly 2 million brain cells are lost. But before you can react, you need to recognize the signs. To recognizing a stroke, the fast warning signs, doctors use a simple acronym. FAST. F, face. Ask the person to smile. Does one side droop? Arms. Ask them to raise both arms. Does one arm drift downward? S, speech. Ask them to repeat a simple sentence. Are the words slurred or strange? T, time. If you see any of these signs, it's time to call emergency services immediately. But here's the reality: sometimes, even when you recognize the signs, emergency help takes time to arrive, and during that time, the brain is still in danger. That's where this life-saving technique comes into play. 3. The 3-minute trick, the simple act that could save your brain. Experts in emergency medicine emphasize that while waiting for help, keeping blood flowing to the brain is the top priority. One of the most effective ways to do that, especially if someone is conscious, is a method known as controlled deep breathing combined with hand stimulation. Here's how it works. 1. Sit the person down safely. Make sure they're not at risk of falling or injuring themselves. 2. Encourage slow, deep breathing. Ask them to take long, controlled breaths in through the nose for 4 seconds, out through the mouth for 4 seconds. This helps maintain oxygen levels and keeps blood pressure stable. 3. Stimulate blood flow using the hands. Ask them to repeatedly clench and unclench their fists or gently rub their fingertips together. This seemingly small motion promotes circulation and can help maintain blood flow through smaller vessels that connect to the brain. If the person is unable to move one hand, focus on the other side. The goal is simple: keep oxygen moving, keep circulation alive, and prevent complete stagnation. This 3-minute technique won't cure a stroke, but it can buy time that could make the difference between full recovery and irreversible brain damage. For the science behind the trick, why does this simple act work? Because the body's circulation system is like a network of highways. When one route of blocked arteries shuts down, smaller side roads, called collateral vessels, can reroute some blood to keep vital areas alive. Deep breathing increases oxygen saturation in the bloodstream. Gentle movement, especially of the hands and arms, stimulates the muscles and helps the heart pump blood more efficiently. Studies show that even mild physical stimulation during the early phase of a stroke can maintain microcirculation in the brain. That's why movement, breathing, and calmness are critical until medical professionals take over. The worst thing to do is panic or lie completely still. The brain needs the oxygen flow, and every small action that maintains it can protect more brain tissue. 5. The needle technique myth. What not to do? You may have heard online that pricking fingers to release blood during a stroke can save lives. Let's be clear, this is a myth and it's dangerous. There's no scientific evidence supporting it. In fact, trying to pierce the skin can cause infection, waste precious time, and worsen the situation. The safest actions you can take are the ones rooted in real emergency medicine. Call emergency services immediately. Keep the person conscious, calm, and breathing deeply. Use the 3-minute movement and breathing technique to promote blood flow. Your goal isn't to fix the stroke, it's to keep the brain alive long enough for help to arrive. 6. The hidden early warnings. Catching a stroke before it happens. While we often think of strokes as sudden, the body sometimes gives subtle warnings in advance. Recognizing these can prevent disaster entirely. Look out for sudden, temporary vision loss in one eye, brief weakness or numbness in the face or limbs, unexpected confusion or difficulty speaking, dizziness, loss of balance, or sudden severe headache. These mini strokes, known as TIs, transient ischemic attacks, usually last only a few minutes, but they're your body's way of shouting, act now. Up to 1/3 of people who experience a TIA go on to have a major stroke within a year if they don't seek medical care. If you or someone you know experiences even one of these symptoms, see a doctor immediately. It could be the warning that saves your life. 7. Long-term prevention. The real power against stroke. The truth is, the best way to fight a stroke is to stop it before it starts, and that means controlling the major risk factors. Blood pressure. Keep it below 120/80 if possible. High blood pressure is the #1 cause of stroke. Cholesterol. Eat heart-healthy foods like oats, olive oil, and fish. Avoid trans fats and processed snacks. Exercise. Even light daily movement, like 20 minutes of walking, can cut your risk by nearly 40%. Stay hydrated. Dehydration thickens the blood, increasing clot risk. Quit smoking and limit alcohol. Both damage blood vessels and make strokes more likely. And for seniors, routine medical checkups are crucial. Many strokes happen because of underlying conditions like atrial fibrillation or diabetes that go unnoticed for years. 8. The 3-minute rule in real life. Success stories. Medical professionals have reported countless cases where quick thinking and calm action changed everything. In one case, a 68-year-old man in Texas suffered sudden arm weakness and slurred speech while at home. His wife recognized the signs, had him sit upright, guided his breathing, and kept him alert with gentle hand movements. By the time paramedics arrived, he was still conscious and responsive. Doctors later confirmed that her quick action likely prevented major brain damage. In another instance, a retired teacher in Japan suffered a mild stroke while waiting for an ambulance. Her son, who had seen a public health campaign, helped her stay calm, focused on breathing, and gently massaged her arms. She recovered with minimal after effects thanks to those precious 3 minutes. These real-world examples prove one thing: knowledge and action matter. You don't need medical equipment or training to make a difference, you just need to know what to do. 9. What to do while waiting for help. Step-by-step recap. Let's summarize the life-saving steps once more. 1. Call emergency services immediately. Don't wait to see if it passes. Every minute counts. 2. Keep the person sitting upright. This prevents pressure on the brain and supports blood flow. 3. Encourage calm, steady breathing. Deep inhalation through the nose, slow exhalation through the mouth. 4. Gently stimulate movement. Clench fists, move fingers, or massage hands and arms to promote circulation. 5. Note the time symptoms began. Doctors need this to decide on treatment options, like clot-busting medications. 6. Never give food, water, or medicine. Swallowing may be impaired, which can cause choking. These actions, though simple, could preserve brain function and even save a life. 10. A final message. Why every second counts. Here's something that's often overlooked. Recovery from a stroke isn't just about survival, it's about quality of life. Every minute that blood flow is restored sooner, the better the chances for walking, speaking, and living independently again. Doctors often say, time is brain, because it's true. The faster you respond, the more brain you save. So remember, if you're a senior or have loved ones who are learning the signs, stay calm and use that 3-minute trick. It may seem small, but in those moments before help arrives, it's one of the most powerful things you can do. Strokes can strike anyone, anywhere, at any time, but with knowledge and action, you have the power to fight back. Recognize the warning signs, act fast, and use the 3-minute breathing and movement technique to protect your brain while waiting for help. If this video taught you something new today, make sure to subscribe to our channel for more life-saving health insights and wellness tips. You never know, the next video might help you protect not just your life, but someone else's too. Stay safe, stay informed, and remember, quick action saves lives.